African farmers have never had good weather forecasts. And so actually by using AI, we can give them far better weather forecasts than even rich farmers in Europe or the US have had in the past. And so they can get advice about which varieties to plant, when to sell, how to deal with any diseases that come along in their crops, just taking a picture and getting that advice. And so we're already rolling those systems out. And so agriculture, I see, is very important. And that's one where once you launch something like a chicken hatchery, then the private sector comes in and you can move on. We're completely unexpected, including, over 95% of the USAID people being let go. It's about 10,000 people worldwide, almost 4,000 of those in Africa. And so they're gone. And so even tracking what's going on, they were a very high percentage of the health expertise in Africa. For example, in Nigeria, they had 214 people, they have 0. In Ethiopia, they had 140, they have 0. So, a lot of the stories are now coming out about that. And, it should remind us, these aren't just numbers. These stories are very tough. One of the most extreme was that there was a mistake made that somebody thought a U.S. grant was for condoms for Hamas because they just did a search for the word Gaza. But in fact, that grant was to prevent babies from getting HIV in a province of Mozambique that unfortunately has the name Gaza. So it was close. It was 1,000 miles away, and it was preventing HIV instead of condoms for Hamas. So that's the kind of care that went into the cuts that took place. So we are going to, we're going to hit a low here, and the estimates of the number of deaths involved are, still there's quite a range, but in the end it will be over 1 million deaths because of these cuts. Now, that doesn't take us back to the 10 million a year, and at the turn of the century, people didn't, realize. So we have to remind people this is a very successful endeavor, even though we're going backwards for a period of time here. Innovation can reduce our costs. For example, the Gates Foundation was able to prove that the HPV vaccine, instead of needing 2 doses, you get full protection with 1 dose. And so not only the countries that get Gavi vaccines, but actually a number of countries, including the UK and 20 others, were able to save in their healthcare budget because we made that investment. And the ability to prove something like that, the only people who have that expertise are either the pharmaceutical companies who make the vaccine or us, because we've recruited a lot of vaccine experts in to do these cost reductions. Gavi has brought the cost of vaccines down very, very dramatically, and that's why even if we were flat funded, we could add new vaccines for things like HPV, RSV, and malaria. And, with our reductions, we'll be able to do less of that. But we can continue to get these costs down. Some things we do, like polio eradication, that the world is spending over $1 billion a year on that, which I'm the biggest supporter of. But as we succeed with that, that goes to 0. Just like with smallpox, when that was eradicated way before there was a Gates Foundation back in 1980, we haven't had to spend on that since then. And so, understanding how to get these delivery costs down and have really inexpensive drugs and vaccines is part of the reason that progress will resume. We will integrate these systems, we'll find some efficiencies, and depending on the level of generosity, we can reverse these trends in somewhere between 2 to 5 years.